All right, we're going to do some long-term care insurance training on how to make sure that a policyholder meets the criteria to use their long-term care insurance policy to pay for their care. When you send in your nurse or when your staff member comes in to do the assessment, you're going to look for some key activities of daily living. All long-term care insurance policies state that the policyholder needs to be functionally incapacitated with at least 2 activities of daily living. So that's what we've got here, functionally incapacitated. These are the activities of daily living that they're looking at. Bathing, continence care, dressing, eating, toileting, and transferring. Now, it's also important to understand that some policies state that they need to be a hands-on assist, others can be a hands-on assist or a standby assist. So when you're looking at the policy or talking with the intake line, qualify, does this policy state that there is a functionally incapacitation? Does it need to be a hands-on assist or a standby assist, or can it be either or? Substantial supervision is pertaining to a cognitive impairment, and we'll hit that as well. Now, most of these policies state that there must be at least 2 activities of daily living. Now, some of the older policies, though, they may just state that they need to be have a medical necessity. So again, there is no identical policy. You need to qualify it. What are the triggers for the policy? Some of them, if you do a pen treaty policy, there may be a lot more liberal definition of activities of daily living. These activities of daily living are actually assigned by Medicare, and that's why these are the core of almost every single long-term care insurance policy. Now, also for a functionally incapacity, if you're looking at a long-term care insurance policy, not a short-term care insurance policy, they usually state that they must be chronically ill as well, and that that chronic condition needs to be anticipated to last at least 90 days. So if grandma fell and broke her hip and just needs some hands-on assistance with bathing, dressing, and transferring for 3 weeks, and after that she's 100%, and there's no underlying medical condition that caused her to have that to be functionally incapacitated, then she will not meet the criteria of the policy, even though at that time she did need the activities of daily living with a hands-on assist or a standby assist. So it's important to understand that what the activities of daily living are that are going to trigger the policy, whether or not they have a chronic condition that is going to be anticipated to last greater than 90 days, and is it a hands-on assist or a standby assist. Now, if they have a cognitive impairment, then they do not need to meet any of these triggers of activities of daily living. A cognitive impairment is defined as that the policyholder needs substantial supervision for safety purposes for themselves or others. For instance, if they have a diagnosis from a medical professional of Alzheimer's disease and they've had a mini mental state exam or a SLUMS test that has confirmed the cognitive impairment, and they are on medications that if they don't take these medications, then their condition can be worsened and their health will decline and they could possibly be injured, then they need substantial supervision for safety purposes for medication reminders. They also, somebody with dementia may wander outside, get lost, and not be able to find their way back home, and they need substantial supervision for safety purposes to make sure that they can return home if they are exit seeking and go outside. Or they may have the habit of getting up in the middle of the night, turning a pot of coffee on, starting a stove, and then going back to bed, and then they could put their spouse, or if they're in an assisted living facility, they could put others at risk by burning down that facility. So again, kind of summarizing the triggers for activating a long-term care insurance policy, it's important to understand that there are key activities of daily living that need to be identified. There usually needs to be at least 2 of them. Identify whether or not this is going to be a hands-on assist or a standby assist. It's important to know that before you initiate care and then use a policy. If there's a cognitive impairment, there is no need to trigger any of these activities of daily living, but there must be a diagnosis, there must be a standardized test, and it must be for safety purposes. And the condition must be anticipated to last greater than 90 days for most long-term care insurance policies. That isn't the case for short-term care policies, but you're going to want to qualify that in the policy when you're talking to the intake number.